I'm Becky Keith with Muhlenberg County Health Department, and I intend to keep this at my 2 minutes, I was told, but I've been with the Health Department for 25 years, and about 5 years ago, well, I'm going on my 5th year, I took over as Director of the Health Department as well, as providing nurse practitioner services. What I really wanted to say today is that we are meeting, we're facing very different things in our community, well, in our world than they did in the past. I happened to get out the archives today from 1955, and the immunizations were a big issue. Their immunizations that they did were smallpox, typhoid fever, polio. TB deaths were higher than the state average in Muhlenberg County, and there were 8 designated beds in Madisonville for TB patients, and there was a waiting list. So the big issues at school, health issues, were sanitary waste and clean water. In fact, rodents were a big problem because the sanitary waste was not under control. Interestingly enough, chronic diseases were the biggest killers, especially heart disease and cancer. And obviously that's not changed. So there are 7 core services that we're mandated to provide and that we do provide: enforcement of public health regulations, surveillance of public health, communicable disease control, public health education, public health policy, families and children risk reduction, and disaster preparedness. But our biggest goal in public health is to provide preventive services. Prevention is a big goal now with, I think, all providers. But we are to assure that there are preventive services in our county. That is family planning, prenatal care, well child care, WIC services, adult preventive services, and chronic disease monitoring and support. But even in 1955, surveying the community provided us with a knowledge of what affected the health of our people and allows the formation of an effective plan. Because without a healthy environment, we cannot grow healthy children, and it takes a healthy workforce to procure economic health. This is a very important mission that we have here today, and our issues are even more complex than they were then. Becky Hendrix has worked with our health department a long time, and she headed our recent community assessment. And by surveying our community and gathering data on Muhlenberg County citizens, it's a very valuable document as to the current status of our population, and it's really worth a good look, and she's going to speak about that briefly.
I'm Betty Hendrix, and as Becky said, I've been with the health department quite a while, and I also was with the hospital quite a while, and as my husband told me, that makes you old. In 2015, the health department conducted a community-wide assessment. The top 5 problems identified by the respondents: alcohol and drug abuse, prescription drug abuse, child abuse and neglect, teen pregnancy, and tobacco use. Does that sound familiar? If you looked at what the 2020 vision just did, pretty much the same thing. The top 5 negative behaviors identified was substance abuse, being overweight, tobacco use, lack of exercise, and poor eating habits. Over 54% of the respondents agreed that they would support a no smoking indoor policy for Muhlenberg County, and over 64% of them said that they would support a statewide policy. One of the essential public health services that Becky was talking about is that we want to address is to inform, educate, and empower people about health issues. That is my major responsibility, is community education. Of course, this is accomplished through individual and community education. We provide parenting education through our HANDS program, which is a parenting program where we do in-home visits. It's free no matter what your income status. We also provide TB education. I am also a licensed diabetes educator, and this spring we collaborated with the County Extension Office to provide diabetes classes. Another thing that we provide is education on cancer, nutrition, physical activity, the hazards of tobacco use, abstinence education, STDs. I could go on and on. Any type of preventive education, we can provide it. We either provide it directly through the health department, or I go to your site. I go frequently to the schools. Another thing that we do with the schools is we go in and we do the vitality screening. Some of you all may be familiar with that, especially if you're a teacher. This is through your insurance program. And this, what we do is we go in, we check blood pressure, cholesterol, BMIs, provide education. We don't just check it, we talk to you about it too. One of the things you may have seen me sitting out front, I had what we call dunks. If you haven't heard of the Zika virus, I'm sure that you will soon. This is a virus that is brought by mosquitoes. Fortunately, we don't have it here in Kentucky yet, but if you've seen the news, you've seen that Florida does. It is in the United States. The dunks are to put in any type of standing water that you have, and what they do is they kill the mosquito larvae, keep them from reproducing, and hopefully get rid of the mosquitoes. They are free. Please, when you leave here, grab you 2 or 3 bags. As others have said, we can accomplish a lot more through collaboration than we can individually. And collaboration is something in my 16 years with the health department that I have definitely seen that Muhlenberg County is very, very good at. Thank you.